Thank you all so much for having me join your meeting today. I'm super excited to be here, and I see a lot of familiar faces, of course, and just to give a little background of my role and my engagement with the PH community for those of you I haven't had the pleasure of meeting before. I work for CVS Specialty. I've been with CVS for almost the past 7 years, and I am the national liaison of patient advocacy and engagement within our CVS Specialty division. So I started focused solely on PH, but have expanded my role a little bit. It's evolved over the years, and now even addressing a lot of different health equity initiatives and trying to find resources, just as the ones that Lanice was mentioning too. So I just feel so fortunate to get to be in partnership with Team Phenomenal Hope and get to have time with you all today too. I started working even before joining the CVS team with the PH community back in 2013. So at that time, I did not know what PH was, just really engaged with the community, helped to organize fundraising events, and worked with support groups, all different ways that we are able to connect and share resources. So I feel so fortunate to be able to be part of the PH community alongside you all and our amazing colleagues at all the different nonprofits and foundations, and even our industry partners and specialty pharmacies too. So I know that there are so many different challenges and hurdles and hoops to jump through, every iteration of that, especially when working through insurance and copay assistance. And those resources are just constantly changing. So what I was hoping for today is to just talk through kind of what's available, what I've seen, and I really encourage you all to share any experiences you have had. And even though I'm with CVS, this is applicable to anyone serviced by any specialty pharmacies, or even having to go to retail for a couple of the PH medications as well. I try to talk to people and say it's so frustrating to be in that position, and I can only try to imagine, especially when someone's counting down the days left of medication, or just getting phone calls and having to call numbers that you're talking to so many different people. It's hard to keep it all straight. So if our conversation today can help navigate or make you feel like, okay, at least I have the mindset. I know as soon as I get a handle on one thing, it may change, and we're in it together. And I know some resources I can lean on to get through it. I think that's part of it. All of us just being in it together. This is totally not formal. Please feel free, like Elenice mentioned, to add any questions, throw them in the chat, and we can run through. I know it's a lot of information to digest. But specifically with all of these slides, I can certainly share these after the fact, and some other resources too that'll help out. And it's really, I like to start off just by saying we're going to talk through all of these different areas under the copay assistance needs and insurance, navigating all of these different routes to get the treatment that you need. But there truly is no one size fits all answer. So really, it's just giving some options and some resources to be able to really get through whatever situation you face at any given time. So ultimately, first and foremost, be your own advocate. I know there's a lot of different pieces under that, and it can be really a struggle. Especially, we know this is just one piece of the puzzle of your overall health and well-being, and so many different things play into it. But being able to speak up for yourself and rely on those that you have, your care team, just this, I have to call out just Team Phenomenal Hope support group, everyone coming together, being able to talk through these challenges and really pick each other's brains, learn from everyone's experience, get those best practices is a huge piece of it. So you can see here on the screen lots of different pieces of the puzzle, like I mentioned, but choosing the right plan. We'll talk a little bit about that and some resources that can help you get what's right for you. We know we're in open enrollment right now as well. So while I'm not an insurance expert, I rely on my colleagues to really dig through and understand what's happening, and being able to navigate, because there are so many different types of benefits and plans, and insurance is a whole other language that I do not speak fluently, probably just enough to get myself in trouble. But then, of course, the financial assistance resources, those foundations, and their eligibility, their application process are quite challenging and may change year to year, even if you don't change anything with your plans. So I'll talk through each one of those in far more detail. I don't have slides on each one, but I might pull up a couple websites just to talk through it. And of course, just being able to find other resources too, if applying for disability, or if you have legal aid needs and appeals, and getting that counseling and from those experts in each of those areas to get what you actually need. And there are lots of different resources again that we'll share at the end. So just jumping right in, with your medical history, we're going to talk through some ways, and I'd like to preface this one as well, is we know that you all are connected with a PH specialist and getting the care that you need. And your specialist, their office, your prescriber, your nurse, your doctor, the care team there, they know the ins and outs of pulmonary hypertension and what you're needing to go through. So I would say taking a look at these notes, specifically thinking in terms of if you have an emergency need where you're going into an ER, or if you're going to an urgent care facility, and sometimes even seeing a different specialist that may not understand what PH is. So that's more so trying to think about the background of when you're explaining what you're going through, the impact that you can have on your medical record, and how your insurance and your benefits are seeing that and viewing that information as well. So that's where we really like to encourage people, if you're telling your story, if you're going through something and not speaking to your PH specialist at that time, but definitely being able to speak to using more than one sentence, not just saying, well, I feel good today, I didn't feel good yesterday. You know, we know it can change day to day, hour to hour, of how you're feeling and what you're going through. So being able to think of those descriptive words that will give a full picture, and being able to use examples, I think we've heard is even more helpful for some of those providers, medical providers that are not specialists in PH. So being able to say like, hey, I couldn't even walk to my mailbox 3 days this week, or I could only walk up 3 steps before I had to rest. You know, it can vary, we know, but being able to tell that story, I think, can be really impactful when you're talking to those healthcare professionals, or even talking to your insurance if they have questions. Sometimes the insurance company may see something that you're doing better on a medication or a therapy, and they see that as an indicator of, oh, great, you're getting better. You might not need this medication any longer. We all know that's not true, but the insurance company does not know the ins and outs. So we just want to make sure that none of that would negatively impact their approval of any therapies that you're on. So some of the ways, I know because it's hard to think of all of those different things when you're in a very short appointment or you have limited time with those providers. It's hard to rattle everything off the top of your head. So I talk to our nurses that I work with and try to get a lot of different ideas because it's not a one size fits all again. I know everyone's different. I'm different with the way I document things compared to my sister. Like we're very different, but you have to find what works for you that can best support you in those situations. So creating your own documentation. And these are just a couple ideas. Starting a calendar, using something if you like to physically write something down, or keeping a note in your phones. Like I know a lot of people that do that, or daily journal, and then being able to pull out a few things. I talked to a couple people that literally will just put a smiley face, a frown face, or a straight line, on each day. They can get a full view of what the week looks like, what that month looked like, because it is hard to recall, especially in the moment that you're in those appointments. You're feeling what you're feeling in that exact moment. So I know smartphones have a lot of different apps and kind of health apps that you could track and document. So I guess I'll just pause there real quick. If anyone has any other good ideas, I love hearing, so I can share with others too. Or if you think of something and want to share at the end, or throw it in the chat, that you're all more than welcome to. We can keep running through. I see your hand is raised. Did you have one that works for you well? That is incredible. Truly. I mean, that's awesome. And what a great way. Thank you so much for sharing that. What a great kind of snapshot, like you said, with the oxygen, being able to have all of that at your fingertips, and with even being able to weigh yourself and tracking that and noticing those changes. I love that. I love that idea.
That was really, you know what, yeah, that beats anything that I do, quite frankly. Um, and I love that idea for the simple fact that I know that most of us, when we go to the doctors, one of the first things, at least my doctor says, is, how's your walking? How far have you walked? What are you doing? At what point do you get tired? And I think what Charlotte just said will help me more to write down, because he's very involved with my exercise, and I think that that's phenomenal.
Yeah, because you don't want it to be overwhelming. You don't
Yeah.
want documenting to add more stress. So that's exactly it. What works for you? Kathleen, do you have an idea too? What works for you? Yeah, but that's cool. It's cool to hear because I know there's a lot of resources out there, but you want to hear from someone that's having success with it and it works well for you. I love that. I'm gonna have to look it up. And it's okay, I think, just to make it, if you don't have something you're already doing, just to start small, and maybe as you practice it. I've talked to a lot of people, even just journaling. It's building up that practice, and then maybe you can add on as you go. Another idea that I've heard too is sometimes it's too much. I'm already exhausted. I don't want to sit down and think about how my day was and document it that regularly, or even my week. So I've talked to a couple of people that have like a weekly check-in with one of their friends or family members, someone that they feel comfortable sharing with, and that person is able to take notes, or write it, type it up in an email and just email it to that individual, so they can pull it up on their phone when they're at their appointments too. So lots of ways. I'm sure y'all we'll come up with some even down the road that we'll have to share. So thank you all so much. But yeah, all of that just really can impact those appointments as you're going through and sharing information with your provider. And then, of course, we know that the insurance companies are kind of digesting all of the records, all of the notes that are sent into them. So, in the case of denials, which is like dun dun dun, how do we handle that if your insurance plan says that you're denied? So, I know we've got a lot of questions here to ask, but first and foremost, do not panic. That's the most important thing because there are a lot of steps that can be taken. And truly, before you even ask any of these questions of your insurance company, I would say take a pause and don't go down that path right off the bat. I would suggest that you double check with your doctor's office first because most often they have already received notification about the denial. Also, touch base with your specialty pharmacy because they as well have already received notification. I know when we get a denial, when someone at the pharmacy is running that claim, there's a lot of information. Your specialty pharmacies will be able to reach out directly to your benefits, try to work through that in conjunction with your doctor's office to get those authorizations in place. So hopefully you're not having to question and ask all of these types of things of your insurance company, because that in itself, I know you can go down the rabbit hole and that can be exhausting, truly. So with that being said, after you're not panicking and you've already talked to your doctor's office, oftentimes there's not a lot of action that you may need to take. But in the case that you do, these are just some suggestions. If your insurance company or your benefits are contacting you, ask them why. Definitely take notes so you can relay that back to your provider's office and your specialty pharmacy, getting more clarification if it comes to finding out who was actually reviewing this and what led to that decision. That way you can work with your prescriber, your nurse or your doctor, your nurse coordinator there to try to find out exactly what needs to be done to get approval. And I know there's a caveat here of asking if there are other covered therapeutic options. So that's something certainly to be aware of with your insurance plan. But truly, what we always would defer to is what your specialist, what your PH office is telling you. They know best. They're working with you on your care plan. So I would always defer back. We don't want you to have to make decisions just due to the insurance. And even with what they call prior authorizations, I know our team is working on a regular, constant basis with PH specialist offices to make sure that all of those prior auths are up to date. We're getting them renewed. And if for some reason there's additional documentation required, of your doctor's office, there's different options that we can explore and your specialty pharmacy can explore to ensure that you're not running out of medication throughout that entire process, because it can be back and forth. There's a lot of paperwork involved, and a lot of different things, even if they have to appeal. But throughout that time, it's really important. I cannot stress enough just to tell your pharmacy how many days left you have on hand and ask, is there any way you can send an emergency shipment? Because there's a lot of different options there too. So always asking, and I know here in saying ask your PH care team for assistance, it's really speaking to that full picture, everyone that is involved in you getting the therapies and medications that you need.
And sometimes it could come down to just one little number, because everything is coded by numbers. And
Mhm.
if they transpose the numbers, then it means a whole different diagnosis.
Right.
And that can also happen. But yeah, when you call whoever your specialty pharmacy is, I found out for myself, it cut out a lot of steps.
Absolutely. Yeah, I cannot recommend it enough. I know it's like these are great questions to ask your insurance company, but go to the source first that you know is on top of it. So, absolutely. If in the case that it is an actual denial, there are, well, I know we've talked through some of these, but there's other resources. A lot of the therapies may have manufacturers that have assistance programs for what they would say uninsured or underinsured. So even if you have an insurance plan, we might call that underinsured, where it's still not covering the medications that you need. So you can always go to those, look for all these different resources, talk to them. I know Team Phenomenal Hope is connected with the entire PH community and able to work through and kind of offer those up. Your specialty pharmacies, there's a ton of different resources that you're able to try. And I would say too, like even with the the term denial, as Lanice mentioned, there might be some situations like just very little misses in the system. So if some insurance companies still use physical fax machines, or if there's a phone number, if it's a digital fax of documentation, if one of those phone numbers are slightly off, they might not have received that documentation from your provider. So that could even be something where it's not actually a denial. It might just have been closed because they didn't receive all the information needed. So that's why it's really important to try your best not to stress, even though I know in the moment that's difficult. but just try to keep that in mind. Okay, well, there's always something else we can try. I'm just going to work through this, or have someone that you can lean on that can work through it for you as well. And I know I'm just jumping in. I see Kathleen's comment about being able to utilize the specialty pharmacy to work through those issues with copay assistance, and it's ever changing. So that's what I learn something new every day. It's the fact of sharing whatever the current situation is and how to navigate through that. But kind of having that mindset, like, okay, there's going to be challenges, and when I run into that at that time, I'm gonna know there's other people I can lean on, and I'll work through it. The most important thing is you're taking care of yourself. And I've talked to some people that are experiencing this, and it's hard not to go down that path right off the bat, like, what am I going to do? I'm not going to be able to afford this. I just have to stop. That's not, try your best not to go to that line of thinking first, because there are lots of other options that we can explore. And again, always going back to your prescriber's office for what they recommend. If it ends up denied, if they appeal, if worst case scenario you can't get that individual medication covered, they are going to know what to do next, that would be best for you. So just try to keep it all in mind. I know it's a lot in the moment. It's easy to say today, of course, but just lean on all of those that are involved, and the resources that you do have. So we're going to run through some of those additional resources and tools that I keep mentioning. Just a few here. And again, I will share these, so you'll have all of these slides after the fact. But a huge shout out to Team Phenomenal Hope. I know with the Megan Michelle Hicks Fund for Unmet Needs that Lanice mentioned at the start of our meeting today. But that is just an enormous resource. I know I'm constantly sharing it. All of the nurses and my colleagues that I work with, were sharing that at doctors' offices and on the phones with patients. It really can help to offset in the case that you might have a bit of copay. It might offset some of those costs. So being able to utilize that for non-medical, non-medication needs. And there's a few others, that are available like that. These are just some resources on looking through what types of insurance plans might work for you. Being able to, so I'm not able to recommend a plan, but there are counseling available. You know, if you're looking at the marketplace plan options or re-enrollment or looking at Medicare, you'll be able to search through that. If you don't feel comfortable navigating the websites on your own, although I know everyone on here is tech savvy, you all jumped on this Zoom real quick, and I was like, I need to make sure I get on early. Um, so, you know, if there's questions that you have, being able to reach out and looking through those, I would say also keep in mind too that even when you may have a plan or benefits that you've chosen, if you change nothing year to year, sometimes the insurance may change what they call their formulary or what drugs they cover, or if they require you to try certain others before the next one. So there's a lot of different caveats to keep in mind, but there's always something that your doctor's office and your specialty pharmacy are able to try. So it's really helpful just to again, keep that mindset like, wait, I didn't change anything with my plan. And now they're telling me I am required to use a generic version of this when I know this works for me. You know, you don't want to have to switch if you know something is working, or be required to what the insurance company would consider fail on a medication in order to start the next one. So just kind of keep that in the back of your mind. And of course, again, those manufacturer patient assistance programs are a great resource. You can even talk through that with the manufacturers if you need to.
I'd like to say that on the team, Phenomenal Hope, the Megan Michelle Hicks Fund for Unmet Needs, we can't directly pay for your medicine, but what we can do is if it comes between like your medicine and food, your medicine in your car, your medicine, whatever, you could use our fund to pay food, pay car, whatever, and then use your funds that you already have for the medicine. And that's, like Marcie said, a big help. You know, when you have these copays that are just, good gosh almighty, are you kidding? You know, why
Right.
does this cost so much? You know? And I think lots of times doctors give us medicine, they don't realize how big the copay is. But it can be used for medication to pay for it, but it can be used for other things so that you can take your funds and buy your medicine with it.
Absolutely. Yes. And sometimes if you're tracking maybe your maximum out of pocket expenses, if you do have to pay 1 month, maybe it helps you reach that amount so it drops down. It's really kind of getting a handle on all those things. And yeah, if the Megan Michelle Hicks Fund can help offset other costs in the meantime, I mean, that is incredible. Yeah, just knowing that that can help. I know every little bit helps. So I'm a huge fan.
Thank you.
And then some of the other foundations. So this is where it can get very detailed and very specific. So if I'm not explaining this in the best way possible, or if you have questions, just chime right in. So there are nonprofit foundations that offer copay assistance grants. So these could be applied to anyone that has benefits or has insurance, as long as your specialty pharmacy, I mean, this was how my benefits colleagues explained it to me. As long as you have insurance that your specialty pharmacy can bill, just even if they pay 1 penny, if we can bill the insurance and you still have a big out of pocket expense that you cannot afford, you may be able to apply to any of these foundations to get a grant that your pharmacy then can bill that next to cover your out of pocket expenses. And all of these will be shared. So I don't want anyone to quick rush and have to write everything down. But all of these will be shared afterwards. I'll be able to share these slides. And I saw that question in the chat. So I'll share these slides and even kind of a one quick resource flyer that has all of them on one page, including the Team Phenomenal Hope Unmet Needs Fund info too. So Each one can be a little bit different on what they cover and also the eligibility requirements and even the application process. So keep that in mind. That being said, too, I have been tracking all of these known foundations specifically at least the last 7 years. And truly, it is an ever changing environment. I'm constantly checking. I share that information with my colleagues. We try to get it out into the community as quickly as possible because the other tough part, and I'm sure many of you have experienced, is even if something opens, if you don't get your application in right away, sometimes they can run out of funding very quickly. I've seen some in a matter of hours exhaust the funding that they have available. So they don't disclose their donors, but as soon as they receive additional funding, they are able to reopen. So it is really important to stress kind of the urgent sort of nature. If something opens and you need copay assistance, it's really important to try to get that application in as soon as possible. With the foundations, all of those that I know of, and this is not an exhaustive list here on this screen, but I'll send some resources and run through those too. But each of them do have a website that you're able to apply online if you have the ability to do so. You could also call them, and they typically are able to accept a verbal application. So their representatives will ask you all the questions on the application, and then they'll enter that. If they need additional documentation, you'd be able to send that into them via email or mail. They'll be able to let you know all of those requirements that they have. And again, each one can be very different. With that too, each one does have different amounts of the grants that they may offer if you are eligible and they do approve you. So for instance, the current situation of what I've seen for these on the screen right now, the Assistance Fund, or TAF, they, if you are approved, would approve you for the calendar year. So even if they were open well, let's say I know they were open last month, and someone was approved, they were backdated then. Their grant was backdated to January 1st of this year through December 31st of this year. So they will give you specific dates that you're able to utilize these grants. It's a lot of moving parts. But with the assistance fund too, they do not typically put a dollar amount limit on their grants. So if you are utilizing this grant for all of your PH meds, let's say you're on triple therapy, you might be serviced by 2 different pharmacies. You can use these grants when you're approved at multiple pharmacies. But if you're billing those for 3 different PH medications, you might run through that funding if there's a dollar amount limit quicker. So I would suggest, if you have an option, double check, see what they cover. If they're going to offer up to a certain dollar amount, that's really impactful depending on how quickly you would run through it. So with the Patient Advocate Foundation, with the PAN Foundation, and with Healthwell, they each do put a dollar amount limit that they would alert you of. They would tell you exactly what was awarded. And I've seen those change year to year as well. So that's why it's not a one size fits all. I don't know currently because they unfortunately are all closed as of today. So when they reopen, they would put the dollar amount of what they would offer up to a certain amount. So kind of keep that in mind as you go through it, because if you at the start of the year, let's say, are awarded a grant for copay assistance through the PAN Foundation and it was $4,600, you may run through that and exhaust it before the end of the year and have to go through this process again. And I know it can be frustrating because I've kind of walked through those steps with so many other patients in similar situations. It's really tough. I know it can be defeating, but just kind of having that in the back of your mind, like, okay, when I run through it, then I'm going to find another resource. But just to keep it in mind, so you have your expectation of what may happen if your pharmacy then tells you that the grant is exhausted. Um, The other piece to take a look at for all of the foundations is what types of benefits they accept on the application. So most recently, the Assistance Fund is the only one I've seen for pulmonary hypertension that accepts all different benefits types, including commercial, including Medicare, Medicaid, government plans. The other three that are listed here and some others, they may specify if it's Medicare only or Medicare and Medicaid. So really try to take a look at that and try not to approach it as it's a one size fits all again. Um, I have talked to many people who have not been able to apply online and called in on these phone numbers. Typically in January, that's when there is a very high need, and a lot of the wait times and hold times could be quite long. I've talked to some people that have been on hold for over an hour, almost 2 hours, and it's tough because at that point you want to make sure you're calling and spending your time reaching out to a foundation that has resources available or even has their applications open. That can be another piece. Once you get through, they might say, well, that we don't have any funding available for our PH grants at this time. So with all the moving parts, I'm just trying, I know it can be overwhelming, but I cannot stress enough. It's just expect the unexpected. It's all going to change one year after the other. It's really helpful to have that mindset when you're navigating through. And again, I know I talked about it even on impacting your medical records, but being able to rely on your specialty pharmacy, rely on your PH specialists. They are keeping their finger on the pulse of how to navigate through each of these as well. And one important piece, I guess I should also add with that is once you are approved, if you are approved by any of these foundations, you'll receive specific grant information. So it'll have your member ID number, it'll have the dates that you're approved. It will have also almost like an insurance card, the other letters and numbers like the PCN, the bin code, all of those things that your pharmacy needs in order to bill the grant. So it's almost like an extra insurance card. And that information, it's really helpful for you to keep that so you can give it back to your pharmacy team and ensure they load that to your record and they will have it on file. So it's just kind of taking another step and another timing out of it for the pharmacy to then have to track that down or reach out to the foundations. It's just trying to streamline this complicated process as much as we possibly can together. Great question. And some do. I know right now the PAN Foundation does have a wait list option on their PH grant page. So I would encourage people to sign up for those wait lists. The Assistance Fund has also had wait lists. Currently, right before I jumped on just to double check, right before we got on the call today, and the Assistance Fund is listing actually that they're enrolling patients that were previously on their wait list. So you can't join the wait list at this time as at the time of our call today, but they are processing those. So what I've seen in the past is even joining a wait list, that's not necessarily just getting the update or the alert if they open. It's actually entering your information similar to what they may require on the application, so that when they receive funding, they're going to reach out to everyone on the wait list first. They will contact you. They will ensure that you are still in need of copay assistance and that you give your confirmation, yes, submit my application at that time. And that way you'll get that answer. But yes, great question. Yeah, that one, I know some of the applications do actually require you to answer if you have a grant from another foundation or if you're getting assistance elsewhere. So I would say each one has their own specific requirements. But with that being said, when your specialty pharmacies are billing these grants, if for some reason they do not bill your grant for up to, usually it's like 90 days, it may be that they're seeing that you no longer need the grant. So if you have duplicate, if you're not utilizing one, that foundation may what they call rescind the funds and close that grant. So they would pull the funding back into their bucket to be able to utilize by others. And again, usually I've seen it's about 90 days if you're not using it. Sometimes that does happen, even if you have reached your out-of-pocket maximum, so then there is no actual copay. It doesn't necessarily mean that your pharmacy isn't actually billing the grant or that something's wrong. It just means that you may have met that out of pocket maximum for the year and you don't need to utilize the grant. I've talked to a few people, and that can be a scary letter that you're getting in the mail if it says we're rescinding your funds. But try to find out and see, hey, have I met my maximum? That might be the case. But yeah, so it really depends on the application. To answer your question, Kathleen, if they will allow it, but I would say it may not be necessary, especially in the case if you're approved by the assistance fund that says you're covered fully without a dollar amount limit, you would typically not need to apply to get another grant.
Okay, so basically, so would you recommend, or do they recommend applying for just one grant at a time, or applying for more than one grant at a time in the hopes that somebody will pick you up?
Yeah, I would say wait lists, absolutely sign up for multiple wait lists.
Okay.
um, with the grants though, if there's one open and we have the luxury of multiple being open, I would say choose the one that is least restrictive, that's going to offer the most dollar amounts. You know,
Hmm.
they'll put on there up to, I think Healthwell was up to $10,000 of the grants that they were putting out, and the others may have been like 6,500. So I would say go to those ones first. And the assistance fund, if they say you're covered fully, if they don't put a dollar amount limit, go to that one first. If you want to apply to multiple, I would also encourage you, because you're going to find out pretty quickly, unless they are saying they do need documentation of your financial resources or your tax documents, whatever it might be, you're going to find out pretty quickly if you're approved. So you may not need to apply to multiple at the same time. And some of these do what they would consider like a soft credit check. So some of them you would click a box and say, yes, I agree. It would not impact your credit history or your credit score, but they would confirm some of your financial situation based on that soft check, instead of you having to make copies of everything and mail it in or email it in.
Okay.
Okay. And I know I'm talking a lot and it's a lot of details.
But it's
Um,
great. It's great information.
I just don't want it to be overwhelming because I mean, this is, I get to focus on this on a daily basis. So don't feel like you have to know everything or commit it all to memory or, have everything at your fingertips, but you just know who to go to at the time when you're in need of copay assistance.
And you know what? This meeting is recorded, as you know, so you'll be able to also to go on our website and see the meeting over again if you missed something.
That's right. That's
Yep,
right.
yep.
And truly, even if anyone has questions, if you want to check in with Lenise, and Lenise, you want to ask me, or I'll share my contact info. I'm happy
Okay.
to share any resources. That's what it's all about. We're in it together to find what's best for everyone. Certainly. And the other piece too with the situation, if you don't have a grant available and or any other options, and you do choose to pay out of pocket 1 month, and then you see a foundation might open up that next month, it's still worth applying. And oftentimes, I know I said the assistance fund goes by the calendar year, but many of the others will backdate maybe 1 month from the date that you were approved. So you could always, if you paid something out of pocket, or if you still have an outstanding balance, if it's within that approval time period, you could submit that still to a grant for them to reimburse you, or see if that's something that you might be able to get those dollars back. It's really important because I don't know anyone that would be able to afford if your insurance isn't covering everything. These can be huge copay amounts and they add up quick. The other piece I want to talk to about the foundations is, even once you do have a grant, what that re-enrollment or reapplying process is. It still depends foundation by foundation of what their process is, but it's really important to keep that in mind. So if you do, for instance, Healthwell Foundation, they will let people reapply, but it has to be a month. It's usually about 30 days prior to the grant expiring is when it would open up for you to reapply. With the assistance fund, they actually, if anyone has a grant currently this year, they're already sending out information to re-enroll. So their re-enrollment will open up the end of this month on November 29th. And that goes through December 15th, I believe. What I've seen for that one the last 2 years is that you are able to submit your re-enrollment. You'll receive a confirmation code that you submitted it, it was received, but that does not mean that you were approved fully for your grant. It means they received your re-enrollment and then they're going to process. So you should receive, if they do it the same way they've done the last 2 years, you'll receive two separate communications. So one, that you did complete your re-enrollment, and two, if you are fully approved or if they've exhausted funding, you'll get notification of that as well. That has also happened. I've talked to people that did get their re-enrollment submitted the first day it opened up. So for this year, it's November 29th. And they received their confirmation. They were approved for the grant. They got all of those details. And I've talked to a few people that re-enrolled just a few days later, and the assistance fund had already exhausted funding and they didn't have any left. So it is still first come, first serve, even during those re-enrollment periods. The other piece with TAF is that they did also list on their website that they have up until sometime in mid-January to alert people if they were not eligible, or if they did not have funding available for re-enrollment. So that can be tough too. We always suggest reaching out to your specialty pharmacy, making sure you can try to get another refill in. If your insurance will approve it, as close to the end of the year, so you have a grace period almost in that first month, those first couple weeks in January. And again, throughout all of these processes, I know we've got it down here at the bottom, but definitely let your pharmacy know exactly how many days you have on hand if you're counting them down, and ask those questions. Ask if there's other resources available. Ask if there's a team that your pharmacy has that can help you apply if you need help with that, or if there's anything else you can try. Opening up those questions really can open some other doors. And even if you get the official no, and it can be exhausting just to complete application over application or get keeping all of these straight. We can see all of the acronyms are slightly similar. We know even some of the PAP programs, the names of those are can be fairly similar to the grants. So it's hard to keep track of who you're talking to. I think this is another one that's really important. Save those phone numbers in your phone. I've talked to people that will give me, they'll say, well, I talked to someone, but I don't know who. And I ask them, what phone number did you call? Then I'll search it and kind of play detective to narrow it down and see who are you talking to? We'll figure out what's happening here. But lean on your specialty pharmacy as well to try to get those answers. What else? Is there another? I don't know if there's any other questions in the chat. I can keep going though. Just a few more things to run through on the slides.
No other questions.
Okay, perfect. So I just wanted to show this and I'll attach this as a PDF. Again, this is not only for CVS specialty patients. I would say this is just a flyer that we have. On the front talks about our CVS team, but on the back for everyone, no matter who you're serviced by, again, this is kind of the cheat sheet of the resources that we do know of. So we have it grouped out by financial support for copay assistance here at the top. Then the center, we've got Team Phenomenal Hope, and I know that that's the website that then you can go to find the Megan Michelle Hicks Unmet Needs Fund. Similarly, the Blue Lips Foundation does have a grant. So as Kathleen mentioned, if you're approved for Team PH Unmet Needs and you get that grant, that's the one that you can have for the year, but you run out and you're still in need, maybe you could try some other resources too. And then just some government resources on searching through benefits. So that way you all can have these at your fingertips. I did use this and include this. I think we had done a screen share, maybe one of the other types that we talked through, but just a quick screenshot on some of the updates that Fund Finder can provide. So that's where you can sign up. It's a free website. You just enter your email, create a password, and you can follow pulmonary hypertension, of course, but then any other conditions or needs that you may have that you want to take a look at. I know I've talked to some people that were able to look and see, even for their loved ones, for family and friends that were running through same issues. Fund Finder has, I think, definitely over 200 different conditions, disease states listed. So I've talked to people that are like, this is great. I helped a friend. I was able to point them in the right direction. And what they'll do if you follow the PH Fund, they will text you or email you or both, whatever you opt in, whenever something opens. So they're not going to send you a text if it closes, but right when it opens, they'll let you know, and it's only what you follow. And then you could always opt out or change that. They do not send any junk mail or requests for donations specifically on Fund Finder. And this is something that the PAN Foundation created. So they're collectively bringing together and tracking all of the different foundations that have grants. I have noticed if you look at it and compare it to the cheat sheet, they did not have the assistance fund most recently listed, but I reached out to my contacts, so hopefully they're going to be able to update that. And then if you are able or to log in, or if you have internet access, you can also see at any given moment exactly what's open or closed with these little red lock icons or the green unlock. So it's pretty cool to get that timely, accurate information so you're not sitting on hold and waiting for something that may not even exist. And then I was just going to share this because it's another resource specifically to call out. And again, it's for anyone. You don't have to be serviced by CVS Specialty, but we do have an article that also talks through making sense of financial support on our resource center. And this talks through a lot of the issues we're discussing and offers some of those insurance counseling resources as well. So that was everything I had today. I don't know if there's any other questions or any other areas you'd like me to expand on, whatever you all think is best.
Well, I tell you, CVS Specialty is my pharmacy, and I can tell you, they are phenomenal, and they have worked with me through many, many problems, and I'm so thankful for them. And honestly, we all need to be able to reach out to our specialty pharmacies, or because you know what, there is a lot of information there. And you know, if you can go to the pharmacy and cut down on the phone time waiting for your insurance, I mean, that's a wonderful thing. So, if there are no more questions, are there? Going
No,
once, going twice. Okay.
I thought of something.
Marcie? Marcie did. Marcie's got her own question. Go ahead, girl.
I thought of something I missed, and that was in the case of a couple of the medications that are available at retail.
Mhm.
So, like tadalafil and sildenafil specifically, if you've exhausted all of the options and there's no foundation resources with those generics, there is not copay assistance programs through the manufacturer. Some people may elect to utilize a coupon card. So I know one of them is called GoodRx. You could actually get that by jumping online or even asking your pharmacist at the local retail pharmacy. So you can search even on their website for your medication and get all of that information similar to insurance card. Bring that in, make sure that your provider sends the prescription to your local retail pharmacy where you can see what the pricing is and how cheap it might be or how expensive. It could be either or. But with that GoodRx card, that can drop the price down. And it does also, though, completely bypass insurance. So it would not add into your maximum out of pocket. It's a coupon card that the pharmacy can utilize to discount the medication there too. So that was one thing. Sorry, I forgot that.
No, no problem. And that is a good thing because sildenafil is not a cheap thing. Really,
Right,
it's
right.
not. It is not cheap. Wow. Thank you so much, Marcie, because you know what? These things change and we have to keep up with the changes. And I'm so glad the Fund Finder, I'm going to jump on that. Like, you know, I'm really going to jump on that because, as you mentioned, it doesn't have to be for PAH or PAH. It could be for other diseases. And some of us have more than one disease. So that would be phenomenal to jump on. And Marcie, as always, thank you, thank you, thank you. And I want to thank all of you for logging on and hope to hope to see you all again at our next meeting in January. I don't know what it's going to be about, but hey, I'll let you know. And to wish you all a happy, happy Thanksgiving, a blessed holiday season. And thank you all so much. Be well, be blessed. Take care. Bye bye.
Take care.